هنطلع بيها understand the role of artificial intelligence in combating burnout in healthcare, illustrate the role of artificial intelligence to minimize administrative burden and for clinical decision support, enhancing telehealth and remote monitoring with artificial intelligence to reduce burnout for healthcare providers, assess the role of artificial intelligence in predicting burnout, illustrate the role of artificial intelligence in assisting clinical documentation and in medication management. And finally, we will discuss the role of AI in patient satisfaction and the effect of healthcare providers' burnouts. In our first session, we will discuss the role of artificial intelligence in combating burnout in healthcare. Burnout in healthcare. What is the burnout in healthcare? Burnout in healthcare is a complex phenomenon characterized by emotional exhaustion, depersonalization, and reduced personal accomplishments. It's particularly prevalent among healthcare professionals due to the demanding nature of their work, which often involve long hours, high level of responsibility, and frequent exposure to suffering and death. The prevalence of burnout in healthcare workers. Burnout is a prevalent issue among healthcare workers, with approximately 1 in 3 physicians experiencing burnout at any given time. The syndrome of burnout is characterized by emotional exhaustion, depersonalization, reduced professional efficiency and efficacy, and personal accomplishments. Healthcare workers, particularly preoperative clinicians, are at a higher risk of burnout due to chronic exposure to job stress. And studies have shown that burnout can have significant negative personal consequences, such as substance abuse, broken relationship, and even suicide. Professionally, burnout can lead to lower patient satisfaction, impaired quality of care, medical error, and malpractice suits. Not only does burnout impact the well-being of the physicians themselves, but it also affects the quality of care they provide. It can result in lower patient satisfaction, impaired quality of care, and an increased risk of medical error. This in turn can lead to malpractice suits and substantial cost for health system. The prevalence rates and factors. The prevalence of burnout varies globally and is influenced by factors such as workload, age, gender, education level, and socioeconomic status. Estimates suggest that up to 20% of working population may experience burnout. Physicians have been found to have a higher incidence of burnout compared to other professions. Studies have shown that around 37.9% to 43% of physicians experience symptoms of burnout. Understanding burnout in healthcare requires consideration of various factors. This factor like workload. Healthcare professionals often face heavy workloads, including long hours, high patient volumes, and administrative burdens. This can lead to fatigue and feeling of being overwhelmed, contributing to burnout. Emotional demands. Healthcare workers frequently deal with emotionally challenging situations, such as caring for patients who are seriously ill or in pain, delivering bad news, or witnessing traumatic events. Continuously managing these emotions without adequate support can lead to emotional exhaustion. Lack of control, limited autonomy and control over work schedules, patient care decisions, and administrative tasks can contribute to feelings of frustration and burnout among healthcare professionals. Interpersonal dynamics. Burnout can also be influenced by relationships within the workplace, including conflicts with colleagues or supervisors, lack of support from peers, or feeling undervalued by the organization. Organizational factors. Healthcare organizations play a significant role in contributing to or mitigating burnout. Factors such as inadequate staffing levels, insufficient resources, poor leadership, and a culture that prioritizes productivity over well-being can exacerbate burnout among staff. Work-life balance. Healthcare professionals often struggle to maintain a healthy work-life balance due to irregular hours, shift work, and the emotional toll of their work. A lack of time for rest, for relaxation, and activities outside of work can contribute to burnout. Stigma and culture. There may be stigma surrounding mental health issues in healthcare settings, leading some professionals to avoid seeking help for burnout or other mental health concerns. Additionally, a culture that values self-sacrifice and discourages expressions of vulnerability can exacerbate burnout. Addressing burnout in healthcare requires a multifaceted approach that addresses individual, interpersonal, and organizational factors. Strategies may include providing mental health support services, implementing workload management initiatives, fostering supportive work environments, promoting work-life balance, and addressing systematic issues within healthcare systems. Ultimately, prioritizing the well-being of healthcare professionals is essential for maintaining high-quality patient care and ensuring the sustainability of healthcare workforce. Understanding burnout in healthcare require consideration of various factors زي ما قلنا workload, emotional demands, lack of control, interpersonal dynamics, organizational factors, work-life balance, and stigma and culture. A dedicated doctor, once passionate about caring for patients, now feels overwhelmed by administrative tasks, long hours, and emotional strain. When they are exhausted, they consider leaving the profession altogether. The consequences of doctor burnout are far-reaching and alarming. Not only does it negatively impact the well-being of healthcare professionals, but it also poses a significant threat to patient care. Studies linked physician burnout to increased medical errors, patient dissatisfaction, and healthcare costs. A glimmer of hope. But there is a glimmer of hope emerging from the realm of technology. Artificial intelligence, or AI, is increasingly being explored as a potential tool to alleviate doctor burnout and make a revolution for the healthcare delivery. Let's explore how AI can become the doctor's armor against burnout, empowering them to provide better care for themselves and their patients. What is artificial intelligence? What is AI? Artificial intelligence is the simulation of human intelligence in machines that are programmed to think and act like humans. يعني هو محاكاة للذكاء البشري في الآلات المبرمجة علشان تقدر تفكر وتتصرف زي البشر. يعني إيه تفكر وتتصرف؟ يعني having cognitive abilities like learning, reasoning, problem solving, perception. يعني تقدر تتعلم، تعرف الأسباب وتفكر، تحل المشكلات، الإدراك، استيعاب اللغة، visual perception, speech recognition, translation between languages. It can learn from its experience and adapt to new situations. How AI is accomplished? AI is the methods of making a computer-controlled robot, or a software think intelligently like the human mind. AI is accomplished by studying the patterns of the human brain and by analyzing the cognitive process. The outcome of these studies develops intelligent software and systems. How to know if a machine has AI or not? When a machine can learn from experience, this machine has general learning. It's an artificial intelligence. When a machine takes decisions based on info, this machine has reasoning. This machine will be an artificial intelligence machine. When a machine creates solutions to solve a problem, this machine has problem solving. So it's containing artificial intelligence. There is different types of artificial intelligence. The first one is artificial narrow intelligence, and artificial general intelligence, and artificial super intelligence. Artificial narrow intelligence. Also, his name is weak artificial intelligence. Weak artificial intelligence refers to AI systems that are designed to perform specific tasks and are limited to those tasks only. يعني مصممة لأداء مهام محددة، وما تقدرش تعمل حاجة غير المهام المصممة ليها دي. زي إيه؟ like زي الفويس اسيستنت سيري or Alexa. Siri, a virtual assistant, will access your contact. When I say call mom, Siri access the contacts list, identify the word mom, and call the number. The same thing with Alexa. Alexa, to interact with the technology we use every day. When I say set timers, it's set timer. Share the current weather, access Wikipedia articles, play music from different applications, home automation features. Also example of weak artificial intelligence like mobile phone image recognition system and fingerprint to unlock mobile phone. Weak artificial intelligence operate within predefined boundaries and cannot generalize beyond their specialized domain. The second type, artificial general intelligence, strong AI. Strong AI, also known as general AI, refers to AI systems that possess human-level intelligence or even surpass human intelligence across a wide range of tasks. يعني بيمتلك ذكاء بمستوى ذكاء الإنسان across a wide range of tasks. Strong AI would be capable of understanding, reasoning, learning, and applying knowledge to solve complex problems in a manner similar to human cognition. However, the development of strong AI is still largely theoretical and has not been achieved to date. Artificial superintelligence. Artificial intelligence far surpassing that of the brightest and most gifted human minds. يعني أذكى بكتير من أذكى إنسان. Due to recursive self-improvement, superintelligence is expected to be a rapid outcome of creating artificial general intelligence. So, the types of artificial intelligence: narrow intelligence, weak AI, specializes in one area and solve one problem. Artificial general intelligence refer to a computer that is smart as human in this field. Artificial superintelligence is a machine much smarter than the best human brain in every field. بنقول على الارتفيشال نارو انتليجنس الماشين اللي فيها بنقول عليها ماشين ليرنينج، لان بيتم تغذيتها عن طريق الانسان بالانبوت داتا عن سبيسيفيك تاسك. ومعظم الذكاء الاصطناعي الموجود دلوقتي artificial narrow intelligence، الانسان هو اللي بيعلمه. Most of the capabilities available today can be categorized as artificial narrow intelligence, which means it can assist with or take over specific focused tasks without the ability to self-expand functionality. Machine learning. Machine learning is a type of artificial intelligence that allows a system to learn from data rather than through explicit programming. It involves the use of algorithms that can learn patterns and make predictions based on input data without being explicitly programmed to perform the task. Machine learning algorithms use statistical models to analyze and draw inferences from data. It helps you make predictions that minimize the errors that arise from merely guessing. يعني بتساعد إن إحنا نتنبأ ونبعد عن الإيرورز الناتجة عن التخمين. طبعا في فرق كبير بين البريدكشن والجاثينج. Machine learning techniques find application across various domains, including image and speech recognition, natural language processing. For example, companies like Amazon use machine learning to recommend the products to a specific customer based on what they have looked and bought before. Deep learning. Deep learning is a subset of machine learning that involves artificial neural networks to model and solve complex problems. It's inspired by the structure and function of the human brain, specifically the interconnected network of neurons. Deep neural networks. Deep learning employs neural networks with multiple layers of interconnected nodes, neurons, enabling the learning of complex hierarchical representation of data. Deep learning algorithms have the ability to automatically extract relevant features from raw data, eliminating the need for explicit feature engineering. Application of deep learning. Deep learning technique find application across various domains, including computer vision. Deep learning has revolutionized computer vision tasks such as image recognition, object detection, and image segmentation, natural language processing. Deep learning techniques have been successfully applied to natural language processing tasks like sentiment analysis, language translation, and text generation. Also in speech recognition, deep learning models power speech recognition systems like virtual assistants and speech-to-text applications. Machine learning versus deep learning. Deep learning عندها القدرة إنها تعمل automatic extraction للrelevant feature from raw data بدون برمجة واضحة، عكس الماشين ليرنينج اللي لازم الإكسبرت تعمل selection for relevant feature manually. AI is the overarching system. Machine learning is a subset of AI. Deep learning is a subfield of machine learning, and neural networks make up the backbone of deep learning algorithms. Artificial intelligence. When a computer mimics human intelligence to perform a given task, it's an artificial intelligence. A machine learning is a subset of artificial intelligence that learns to perform a given task from data and improves with experience. Deep learning, a subset of machine learning that uses large neural networks and big data to better solve complex problems. What is big data? The term big data is used in instances in which the data samples are too large to be adequately analyzed with traditional AI methods. In this case, new methods such as deep learning can be used. What is the difference between machine learning and deep learning? Deep learning is an evolution of machine learning. Both are algorithms that use data to learn, but the key difference is how they process and learn from it. While basic machine learning models do become progressively better at performing their specific functions as they take in new data, they still need some human intervention. If an AI algorithm returns an inaccurate prediction, then an engineer has to step in and make adjustments. With a deep learning model, an algorithm can determine whether or not a prediction is accurate through its own neural network. Minimal to no human help is required. A deep learning model is able to learn through its own methods of computing. It's a technique that makes it seem like it has its own brain. Other key differences. Machine learning consists of thousands of data points, while deep learning uses millions of data points. Machine learning algorithms usually perform well with relatively small data sets. Deep learning requires large amount of data to understand and perform better than traditional machine learning algorithms. Machine learning uses algorithms and learns on its own, but may need human intervention to correct errors. And deep learning uses advanced computing, its own neural network, to adapt with little to no human intervention. So, the artificial intelligence is a broad field that encompasses deep learning and machine learning. Its goal is to develop smart tools that can carry out cognitive functions such as problem solving, sentiment analysis, decision making. Machine learning delivers accurate predictions and decisions by identifying patterns in its training data. And deep learning is a subset of machine learning. With this model, an algorithm can determine whether or not a prediction is accurate through a neural network without human intervention. Deep learning models can build extensive knowledge over time, acting as a brain. Machine learning is a branch of AI trained on statistical models and algorithms, which enable it to make predictions and decisions. Machine learning relies on human engineers to feed it relevant, pre-processed data to continue improving its output. It's adept at solving complex problems and generating important insight by identifying patterns in data. Once the engineer finishes training the AI and optimizing its performance, it will follow a standard process. The algorithm will receive new information via user query, analyze the data, find a pattern, make a prediction, and send an answer back to the user. Machine learning example. Here is an example of how machine learning powers on-demand music and video streaming services like Spotify, Apple Music, and YouTube. For a music service to recommend new songs or artists to a listener, machine learning algorithm associate the listener's preferences with other listeners who have similar musical tastes. طب وبتعرف منين listener preferences؟ مثلا من saved songs, playlists, followed artists, and skipped songs. Deep learning. Deep learning is a subfield of machine learning that structures algorithms in layers to create an artificial neural networks that can autonomously learn and make intelligent decisions. To use a deep learning model, a user must enter an input. It's then sent through the hidden layers of the neural network, where it uses mathematical operations to identify patterns and develop a final output, a response. The algorithm's design pulls inspiration from the human brain and its network of neurons, which transmit information via messages. The algorithm receives data, runs it through the input and hidden layers, and generate an output. Example of deep learning, a computer vision for driving. Deep learning model enable autonomous vehicle to recognize and respond to their surrounding, including identifying people, other vehicles, and road signs. AI is the overarching machine. Machine learning is a subfield of artificial intelligence, and deep learning is a subset of machine learning. إيه بقى natural language processing? Natural language processing is a branch of AI focused on enabling computers to understand, interpret, and generate human language in a way that is both meaningful and useful. Natural language processing technique involve processing and analyzing large volumes of text data to perform tasks such as text classification, sentiment analysis, translation, question answering, and text generation. Applications of natural language processing, like chatbot. Natural language processing is used to develop chatbots that can interact with users in natural language, providing information or assistance. Text summarization, automatically generating summaries of long pieces of text. Speech recognition, converting spoken language into text. This is speech recognition. Question answering systems, systems that can answer questions posed in natural language. And finally, information extraction, extracting relevant information from unstructured text data. ايه ال unstructured text data؟ طب ايه هي اصلا ال structured data؟ Structured data is highly organized and follows a predefined forms. هي أي databases تقدر تتحط في tables أو في rows and columns. الريليشنشيب بين الداتا elements ديت بتبقى واضحة. أقدر أعمل لها analysis بسهولة. أي تيبل، أي معلومات موجودة في جداول هقدر أعمل لها بسهولة analysis. زي إيه؟ زي الداتابيزز، السبريد شيتس، أي information موجودة في إكسل في rows and columns هقدر أعمل لها analysis بطريقة سهلة. طيب إيه هي ال unstructured data؟ ال unstructured data ديت lack a predefined structure or clear organization. زي ايه؟ زي example ليها التكست، الايمجز، الاوديو، الفيديو. اقدر اعمل لها analysis ازاي؟ صعب جدا. It allows for a wide range of information types and format. Analyzing unstructured data is more complex due to its lack of predefined structure. زي ايه ال unstructured data؟ زي ال text documents، الايميلز، الارتكلز، الريبورتس. دول صعب اعمل لهم analysis. المالتي ميديا فايلز زي الايمج، فيديوز، اوديو تكست فايلز، السوشيال ميديا بوستس، الكونتنت from social media platforms. ان انا اعمل لها analysis صعب. ايه اللي يقدر يعمل لها analysis؟ الناتشورال language processing. artificial intelligence in healthcare. ازاي الارتفيشال انتليجنس بيتغذى؟ عن طريق الانفورميشن شيرنج. هو اللي بيغذي الارتفيشال انتليجنس. اي معلومه بتدخل على الانترنت عن طريق نشر evidence based guidelines، clinical protocols، chat between الدكتورز، شيرنج للمعلومات الطبيه عن اي حاله مرضيه سواء كانت written او voice chat، الالكترونيك ميلز، الفيديو كونفرنس، كل ده بالاضافه للالكترونيك ميديكال ريكوردز. كل المعلومات الكتير دي اللي بالملايين اللي بيتقال عليها بيج داتا، لارج اماونت اوف داتا، بيتعمل لها بروسيسنج واناليسيس عن طريق الاي اي ماشين اللي بتعمل بريدكشن. يعني بناء على المعلومات المتاحه على الانترنت بيقدر الاي اي يتنبأ بمعلومات تقدر تطور الهيلث كير سيستم. بدأ الاي اي في 1980. السيستم كان اسمه expert systems based on collection of if then rules. قاعدة if then where the dominant technology for AI is the and were widely used commercially in that and later periods. يبقى من أول 1980 كان التكنولوجي اللي موجودة أو ال AI اللي موجود كان if then rule. In healthcare, they were widely employed for clinical decision support purposes over the last couple of decades and are still in wide use today. Many electronic health record providers finish a set of rules with their system today. Rule-based expert system, if-then rules. Expert systems require human experts and knowledge engineers to construct a series of rules in a particular knowledge domain. They work well up to a point and are easy to understand. However, when the number of rules is large, usually over several thousand, and the rules begin to conflict with each other, they tend to break down. يعني كان صعب جدا إن أنا أعمل تحديث للسيستم دوت. If the knowledge domain changing the rules can be difficult and time consuming. They are slowly being replaced in healthcare by more approach based on data and machine learning algorithms. The emergence of artificial intelligence in healthcare has been groundbreaking, reshaping the way we diagnose, treat, and monitor patients. The rise of artificial intelligence. AI in healthcare began with the digitalization of medical records and the development of expert systems that could assist in diagnostic processes. The combination of advanced algorithms, increased computing power, and the availability of vast healthcare data opened up new horizons. And AI become a game changer in healthcare. unveiling the transformative power of AI in healthcare. Artificial intelligence can play a significant role in combating burnout among healthcare professionals by offering solutions that alleviate workload burden, streamline administrative tasks, provide decision support, and enhance overall efficiency. AI offers tangible benefits that have the power to redefine how we diagnose, how we treat, and prevent illness. Let's embark on a journey to explore how AI can shape a future characterized by personalized precision, proactive prevention, and enhanced patient safety. We will discuss the role of AI in combating burnouts, minimizing errors, and maximizing safety. Human error is an unfortunate reality in healthcare. AI, however, offers the potential to act as a guardian angel, reducing medical errors by analyzing vast dataset of past occurrence and suggesting preventive measures. This can dramatically reduce medication errors, misdiagnosis, and surgical complications, improving patient safety. Real-time support become a reality as AI-powered systems assist healthcare professionals during procedures, offering valuable insight and highlighting potential risk, further enhancing patient safety and optimizing clinical decision-making. Efficiency gained, time for what matters most. Imagine healthcare professionals freed from tedious tasks, allowing them to focus on the core of their calling, which is patient care. AI can automate administrative tasks like scheduling appointments, managing medical records, generating reports, freeing up valuable time for doctors and nurses to spend with patients. AI can streamline workflow. Streamlined workflow emerges as AI analyzes data, suggests more efficient treatment plans, optimizes resource allocation, and predicts bed availability, improving the overall healthcare system efficiency. Personalized medicine. The days of standardized treatment plans are fading with the rise of precision medicine, followed by AI-powered analysis of individual patient data. A new era of healthcare is dawning where treatment becomes as unique as the patients themselves. Imagine an oncologist faced with a complex cancer case. They analyze the patient's genetic makeup, medical history, and lifestyle, feeding this data into an AI platform. This digital Sherlock Holmes then sifts through vast databases, uncovering unique disease patterns and predicting potential responses to different therapies. Armed with this personalized roadmap, the doctor can tailor a treatment plan with pinpoint accuracy, maximizing its effectiveness while minimizing side effects. This scenario that was like previously science fiction is rapidly becoming a reality in various specialties. In cardiology, AI analyzes heart scans and patient data to predict individual risks for heart rate, enabling early intervention and preventive measures. Imagine diabetes management transformed with AI continuously analyzing blood sugar levels using wearable devices, suggesting personalized adjustment to medication and diet, and empowering patients to actively manage their health. Beyond improved clinical outcomes, AI-driven healthcare fosters strong patient engagement and satisfaction. Imagine receiving treatment recommendations that truly reflect your unique needs and concerns. This level of personalization fosters trust and empower patients to become active participants in their healthcare journey. This shift toward precision medicine unlocks a treasure trove of benefits: improved treatment efficiency, therapies tailored to individual patient profiles have a higher chance of success, leading to better clinical outcomes. Reduced side effects. By predicting individual responses, doctors can avoid ineffective or overly harsh treatments, minimizing adverse effects. Enhanced patient engagement. Personalized care plans foster trust and empower patients to actively participate in their health. Optimized healthcare resources. By targeting interventions strategically, healthcare system can allocate resources more efficiently. Automating administrative tasks. One of the main sources of burnout in healthcare is the overwhelming amount of administrative and repetitive tasks that take up your time and energy. These tasks include documentation, billing, coding, scheduling, ordering, reporting, and they can distract you from your core clinical work and patient interactions. AI can help you automate some of these tasks using natural language processing, computer vision, speech recognition, and machine learning to streamline and simplify your workflow. For example, AI can transcribe your voice notes into electronic health records, generate billing codes from your diagnosis, suggest optimal schedules and appointments, and provide automated reminders and alerts. AI-powered system can automate routine administrative tasks such as documentation, scheduling, and billing. By reducing the time spent on paperwork, healthcare professionals can focus more on direct patient care, thereby alleviating some of the stress associated with administrative burden. Clinical decision support. Another source of burnout in healthcare is the complexity and uncertainty of clinical decisions, which require you to process large amounts of data, keep up with the latest evidence and guidelines, and balance the risks and benefit of different options. AI can help you augment your decisions using data analytics, predictive modeling, and clinical decision support systems to provide you with relevant and reliable information, insights, and recommendations. For example, AI can analyze your patient's data and history, compare it with similar cases and outcomes, identify potential diagnoses and treatments, and rank them according to their probability and efficacy. Imagine having a colleague by your side, not just another doctor, but one capable of analyzing mountains of data and lightning speed, identifying patterns invisible to the human eye. AI algorithm can analyze large volume of medical data to provide clinicians with real-time evidence-based recommendations for diagnosis, treatment planning, and medication management. By assisting healthcare professionals in making informed decisions, AI can reduce uncertainty and improve the quality of care, potentially reducing burnout associated with clinical decision-making. Predictive analytics. AI's predictive analytics capabilities offer a shift toward proactive healthcare, helping providers anticipate potential health risks and implement preventive measures and tailored care plans. With AI providing comprehensive insight to healthcare professionals, patients receive more personalized, timely, and effective healthcare interventions. For instance, a predictive fall score can help prevent falls among older adults, significantly reducing healthcare costs and visits to the emergency department associated with fall-related injuries. AI can analyze data from electronic health records, wearable devices, and other sources to identify patterns and predict patients' outcomes, such as identifying individuals at risk of deterioration or readmission. Early identification of high-risk patients allows for proactive intervention, potentially reducing the workload and stress associated with managing acute or complex cases. Virtual health assistants. Another source of burnout in healthcare is the lack of communication and coordination among healthcare workers, patients, and other stakeholders, which can lead to errors, delays, conflicts, and dissatisfaction. AI can help you facilitate communication using chatbot, virtual assistants, and telehealth platforms to enable you to interact with others more easily, effectively, and conveniently. For example, AI can provide you with chatbots that can answer common questions, triage patients, and provide education and support. AI also can provide you with virtual assistants that can manage your tasks, appointments, and message. AI can also provide you with telehealth platform that can connect you with patients and colleagues remotely using video, audio, and texts. AI-powered virtual health assistants can provide patients with information, answer common questions, and offer support to self-management of chronic conditions. By offloading some of the patient's education and communication tasks, healthcare professionals can focus their attention on more complex patient needs, reducing burnout associated with repetitive interaction. Natural language processing. The documentation process is a significant contributor to frontline worker burnout. AI tools can help simplify and streamline documentation processes by assisting in real-time summarization of patient encounter, which reduces the need for extensive manual data entry. Natural language processing capabilities allow healthcare workers to dictate notes, recommendations, and care plans, freeing them from the tedious tasks of typing and allowing for an easier and more seamless integration of information into electronic health records. Natural language processing technologies can extract valuable information from unstructured clinical notes, research articles, and other textual data sources. This can help healthcare professionals stay updated on the latest research findings and guidelines and best practices without spending excessive time manually reviewing literature, potentially reducing burnout associated with information overload. Workload prioritization. AI algorithm can analyze task lists, patient data, and other relevant information to help healthcare professionals prioritize their workload more effectively. By highlighting urgent or high priority tasks, AI system can assist in time management and workload distribution, reducing stress and preventing burnout from feeling overwhelmed. Personalized work schedule. AI algorithm can analyze historical data on workload patterns, individual preferences, and other factors to generate personalized work schedules that optimize work-life balance and minimize fatigue. By accommodating the individual needs and preferences of healthcare professionals, AI-powered scheduling systems can help prevent burnout associated with long hours and irregular shifts. This shift toward AI-powered scheduling unlocks a multitude of benefits. Increased doctor time. By automating administrative tasks, doctors can reclaim significant time for patient care, consultations, and professional development. Improve the clinic efficiency. Optimize the scheduling, reduces appointment gaps and missed appointments, streamlining clinic operations, enhanced patient satisfaction, personalized reminder and convenient scheduling options, improve patient experience and satisfaction, reduced healthcare costs. Efficient scheduling optimizes resource allocation and minimized wasted time, leading to cost saving. By reclaiming time for care, this technology empowers doctors and foster a future where they can focus on what they do best, providing compassionate and personalized care to their patients. Foster learning. Another source of burnout in healthcare is the lack of learning and development opportunities, which can make you feel bored or incompetent in your profession. AI can help in foster learning using adaptive learning systems, gamification, and feedback mechanisms to provide you with personalized and engaging learning experiences that can enhance your knowledge, skills, and confidence. For example, AI can provide you with adaptive learning systems that can tailor your learning content and pace according to your needs, according to your goals and preferences. AI also provides you with gamification elements that can make your learning fun and rewarding, such as budget points and leaderboards. AI also provides you with feedback mechanisms that can give you constructive and timely feedback on your performance and progress. Lastly, support well-being. Another source of burnout in healthcare is the lack of well-being and self-care practices, which can affect your physical, mental, and emotional health. AI can help you support your well-being using wearable devices, mobile apps, and online platforms to provide you with tools and resources that can help you monitor, manage, and improve your health and happiness. For example, AI can provide you with wearable devices that can track your vital signs, activity levels, sleep patterns, and stress levels. AI also provides you with mobile apps that can offer you mindfulness exercise, relaxation techniques, and coping strategies. AI also can provide you with online platforms that can connect you with peer support groups, mentors, and coaches. يبقى the role of AI in combating burnout اتكلمنا عن minimizing error, maximizing safety, efficiency gained, time for what matter most اللي هو patient care, personalized medicine, automating administrative tasks, clinical decision support, predictive analytics, virtual health assistants, natural language processing, workload prioritization, personalized work schedules, foster learning and support well-being. Overall, AI has the potential to significantly impact the healthcare industry by providing innovative solutions that improve efficiency, enhance decision-making, and support the well-being of healthcare professionals. By leveraging AI technologies effectively, healthcare organizations can mitigate the factor contributing to burnout and create a more sustainable and supportive work environment for their staff. AI can help you avoid burnout in healthcare by automating tasks, augmenting decisions, facilitating communication, fostering learning, and supporting well-being. AI offering many tools to combat burnout and empower doctors, from automating administrative tasks, streamlining appointment, to analyzing medical data for personalized diagnostics and treatment plans. However, the benefits extend far beyond burnout relief. AI is accelerating drug discovery, optimizing clinical trials, and paving the way for precision medicine. This translates to faster development of life-saving treatment and improved patient outcomes across the board. This is just the beginning. The future holds immense potential for AI to transform healthcare delivery. Thank you. أشكر حضراتكم. لو في أي أسئلة أو أي حاجة مش واضحة أستأذن حضراتكم ابعتولي في الكومنتس. ناخد دقيقة بريك ونبتدي السيشن اللي بعديها. Thank you very much. مساء الخير. مع حضراتكم دكتورة ماري حبيب، ماجستير إدارة جودة الرعاية الصحية من المعهد العالي للصحة العامة جامعة اسكندرية. اتكلمنا في السيشن اللي فاتت عن the role of AI in combating burnout in healthcare. هنتكلم إن شاء الله في السيشن ديت عن leveraging AI to minimize administrative burden and for clinical decision support. Leveraging AI to minimize administrative burden. AI continues to make waves in the world of administrative professionals, providing the support they need to streamline tasks, increase efficiency and productivity. But before we dive into the many ways AI can revolutionize the administrative world, let's get one thing straight. AI is here to assist, not replace. To assist healthcare provider and not to replace healthcare provider. It's a powerful tool that when used correctly will aid your daily tasks and enhance your career. Implementing AI to minimize administrative burden in healthcare involves deploying AI-powered solutions that automate tasks, streamline processes, and enhance efficiency in administrative workflow. Implementing AI to minimize administrative burden in healthcare. Automated documentation. AI-driven transcription and natural language processing tools can automatically convert spoken or handwritten notes into structured electronic health records. This reduces the time spent on manual data entry and documentation, allowing healthcare professionals to focus more on patient care. Billing and coding assistance. AI algorithms can analyze the clinical notes and patient data to assist with medical coding and billing processes. By automatically suggesting appropriate billing codes and identifying discrepancies, AI can help ensure accurate and timely reimbursement while reducing the administrative burden on healthcare staff. Appointment scheduling. AI-powered scheduling systems can analyze patient preferences, provider availability, and clinic resources to optimize appointment scheduling. These systems can also handle appointment reminders, rescheduling, and cancellation, reducing the workload on administrative staff and improving patient access to care. Prior authorization automation. AI can streamline the prior authorization process by automatically checking insurance coverage, identifying required authorizations, and submitting requests to payers. By automating this often time-consuming and error-prone process, healthcare organizations can accelerate patient access to treatments and reduce administrative overhead. Patient intake and triage. AI-powered chatbot and virtual assistants can assist with patient intake processes by gathering medical history, insurance information, and chief complaints. These tools can also provide initial triage assessments, directing patients to appropriate resources or scheduling urgent appointments as needed, thereby reducing the administrative burden on front desk staff. Revenue cycle management. AI analytics can analyze financial data, claims processing patterns, and reimbursement trends to identify opportunities for revenue optimization and cost reduction. By providing insights into revenue cycle performance and potential area for improvement, AI can help healthcare organizations streamline administrative processes and maximize financial efficiency. Compliance monitoring. AI algorithm can monitor documentation practices and coding accuracy to ensure compliance with regulatory requirements and quality standards. By flagging potential issues or discrepancies, AI-powered compliance monitoring tools help healthcare organizations mitigate compliance risks and reduce the administrative burden associated with audit and investigations. Workflow optimization. AI can analyze administrative workflows, identify bottlenecks, and suggest process improvements to optimize efficiency. By automating repetitive tasks, standardizing workflows, and reallocating resources more efficiently, AI-driven workflow optimization tools can streamline administrative processes and reduce unnecessary workload. يبقى implementing AI to minimize administrative burden in healthcare عن طريق automated documentation, billing and coding assistance, appointment scheduling, prior authorization automation, patient intake and triage, revenue cycle management, compliance monitoring, workflow optimization. طب إيه هي ال benefits of administrative work with AI? AI is making a big impact on the world of administrative professionals. Here is how. Automation of routine tasks. Say goodbye to monotonous and repetitive tasks like data entry, email management. AI is helping administrative professionals automate this task, freeing up more time for higher level responsibilities. Improved efficiency and productivity. AI-powered tools streamline processes, reducing errors and increasing efficiency, giving administrative professionals the gift of time and increased productivity. Smarter decision-making. AI provides valuable insights and recommendations, allowing administrative professionals to make informed decisions and tackle complex problems with ease. Better collaboration and communication. AI-powered tools bring team members together and facilitate communication, leading to better collaboration and a positive work environment. Virtual assistants. Virtual assistants, they assist with tasks such as answering emails, booking appointments, and conducting research, so administrative professionals can focus on their priorities. Predictive analytics. AI analyzes data and provides predictive insights, allowing administrative professionals to be proactive and stay ahead of potential problems. Personalization. AI personalizes communications, recommendations, and experiences for client and colleague, leading to improved customer satisfaction and strengthened relationships. Increased accuracy and speed. AI performs tasks faster and with higher accuracy than humans, reducing the time and effort required for administrative tasks. And finally, continuous improvement. AI is always learning and adapting, leading to ongoing improvements in processes and services, ensuring that administrative professionals stay at the front of their field. Leveraging AI for clinical decision support. Artificial intelligence is providing new way to improve the accuracy, speed, and efficiency of clinical decision-making. With the ability to analyze vast amount of patient data, AI is helping doctors and healthcare professionals to make more informed and accurate diagnosis. ايه هو الكلينيكال ديسيجن سبورت سيستم؟ Clinical decision support system is a health information technology system that is designed to provide health professionals with clinical decision support, namely to assist with clinical decision-making tasks. How artificial intelligence is transforming clinical decision support system. AI-based clinical decision support system has the ability to analyze large volume of data and suggests next steps for treatment, indicate potential problems, enhance efficiency, and facilitate the work of healthcare providers. It can leverage the information collected from patients' health data, like, for example, data collected through electronic health records. This new state of affairs is possible mainly because of two reasons. Firstly, because of the high amount of clinical data available, which can be obtained in real time from medical devices and records. Secondly, because of the advances performed in AI, enabling this vast amount of data to be analyzed and optimally used. AI clinical decision support system can improve diagnosis, treatment, and prognosis of a particular medical condition by predicting the probability of a medical outcome or the risk for a certain disease. AI clinical decision support system can analyze past, current, and new patients' data and identify or suggest safety concerns, errors, or care pathway improvements to the user. Their ability to predict with high relevance and precision lead to new way of optimizing patient care. AI-driven clinical decision support system are interactive software systems designed to aid healthcare professionals in making clinical decisions. They provide evidence-based knowledge and patient-specific information at the point of care, which can improve the quality of care and reduce medical errors. Component of AI-driven clinical decision support system. The system typically consists of three main components. The first is the knowledge base. The knowledge base contains clinical guidelines, algorithms, and best practices derived from scientific research and clinical experience. The second, a patient database. The patient database stores relevant patient information such as demographics, medical history, lab results, and medication. And the third is the user interface. The user interface enables healthcare professionals to interact with the system and access decision support at the point of care. What are the types of AI-driven clinical decision support system? في عندنا خمس أنواع. Alerting systems. This system provides alerts or reminders to healthcare professionals based on patient-specific data, such as drug-drug interaction or abnormal lab results. يبقى السيستم اللي بيديني alert alarm. Example of AI clinical decision support system in alerting systems: early warning scores. AI-powered early warning scores can help healthcare providers identify patients at risk of deterioration and take appropriate action. السيستم بيقيس الفيتال ساينز بتاعت البيشنت، وبالتالي يقدر يidentiفy مين البيشنت اللي at risk of deterioration and take appropriate action. Medication alerts. AI-powered medication alerts can help healthcare providers avoid medication errors and ensure appropriate dosing. Laboratory result alerts. AI-powered laboratory results alerts can help healthcare providers identify abnormal results and take appropriate action. بيبعت لي alarm لما يبقى فيه abnormal results علشان أعمل ال appropriate action. Radiology alerts. AI-powered radiology alerts can help healthcare providers identifying potential abnormalities on imaging studies. إيه هي ال benefits of AI clinical decision support system in alerting system? Number one, improved patient outcome. By providing real-time recommendation to healthcare providers, AI clinical decision support system can help improve patient outcomes by reducing medical errors and enhancing the quality of care. Increase the efficiency. AI clinical decision support system can help healthcare providers make faster and more informed decisions, which can lead to increased efficiency in patient care. Enhanced safety. AI clinical decision support system can help identifying potential safety issues and alert healthcare providers to take appropriate action, which can help enhance patient safety. النوع الثاني order entry systems. The systems provide decision support during the ordering of diagnostic tests or treatments, such as suggesting appropriate dosage or alternative medications. Clinical decision support system can be integrated into various health information systems, including order entry system. Example of AI clinical decision support system in order entry system. Order entry system uses AI algorithms to provide real-time alerts for potential drug interactions, duplicate orders, and other medication errors. The system also offers evidence-based medication recommendations based on the patient's medical history and current medication. An AI-powered tool that provides personalized recommendations for preventive care based on the patient's medical history, demographics, and other relevant factors. The system offers suggestions for screening, vaccinations, and lifestyle modifications to improve overall health outcome. طب إيه هي ال benefits of integrating AI clinical decision support system in order entry system? Improved patient safety. The system can help improve medication errors, reduce the medication errors, reduce the adverse drug events, and other potential harm to patients by providing real-time alerts and suggestions for appropriate orders based on the patient's medical history, current medication, and other relevant factors. Increased efficiency. AI clinical decision support systems can automate routine tasks and reduce the time spent on manual order entry, allowing healthcare professionals to focus on more critical aspects of patient care. Enhanced clinical decision-making. AI clinical decision support systems can provide healthcare professionals with evidence-based recommendations and clinical guidelines to support their decision-making process, ultimately leading to better patient outcomes. النوع الثالث من الكلينيكال decision support system diagnostic systems. These systems assist healthcare professionals in diagnosing medical conditions by analyzing patient data and providing probabilities of differential diagnosis. AI-powered clinical decision support systems have shown great promise in improving diagnostic accuracy, efficiency, and patient outcomes. The role of AI in diagnostic systems. AI technologies such as machine learning and deep learning algorithms play a significant role in diagnostic systems by analyzing complex medical data to assist healthcare professionals in making accurate diagnoses. These systems can process large volumes of patient data, including medical images, lab results, and patient history, to identify patterns and trends that may not be readily apparent to human clinicians. طب إيه هي benefits of AI clinical decision support systems in diagnostic systems? Improved accuracy. AI system can help reduce diagnostic errors by providing healthcare providers with additional information and insight to support their decision-making process. Efficiency. By automating certain tasks and streamlining workflow, the system can help healthcare providers save time and focus on delivering quality care to patients. Personalized medicine. AI technologies enable the customization of treatment plans based on individual patient characteristics, leading to more personalized and effective care. رابع نوع, the treatment planning systems. These systems provide guidance for developing treatment plans based on evidence-based guidelines and patient-specific factors. AI-powered clinical decision support system leverage advanced algorithms and machine learning techniques to analyze vast amount of patient data, medical literature, and best practices to provide the clinicians with evidence-based recommendation for diagnosis, treatment, and follow-up care. This system aims to improve clinical outcomes, reduce medical errors, optimize resource utilization, and enhance the overall efficiency in healthcare delivery. In treatment planning system, AI-based clinical decision support system assist the healthcare providers in making informed decisions about patient care by analyzing patient-specific data such as medical history, diagnostic tests, imaging results, and treatment protocols. AI algorithm can generate personalized treatment plans tailored to individual patient needs. These systems can also help clinicians identify potential risks, predict outcomes, and recommend appropriate interventions based on the latest medical evidence and guidelines. The benefit of AI clinical decision support system in treatment planning system: enhanced clinical decision making. AI algorithm can process complex data sets quickly and accurately to support clinicians in making evidence-based decisions about diagnosis, treatment options, and care management. Improved patient outcomes by providing personalized treatment recommendations based on individual patient characteristics and medical history. AI clinical decision support system can help improve clinical outcomes and reduce the risk of adverse events. Efficiency and cost effectiveness. AI-powered clinical decision support system can automate routine tasks, streamline workflows, and optimize resource allocation, leading to increased efficiency and cost saving for healthcare organizations. Continuous learning and adaptation. AI system can continuously learn from new data, inputs, and update their algorithms to reflect the latest medical knowledge and best practices, ensuring that recommendations remain up to date and relevant. Enhanced care coordination. By facilitating communication and information sharing among multidisciplinary care teams, AI clinical decision support system can improve care coordination and collaboration across different healthcare settings. آخر نوع patient monitoring system. This system monitor patient remotely and provide decision support based on real-time data such as vital signs or blood glucose levels. These systems leverage advanced algorithms and machine learning techniques to analyze a vast amount of patient data in real time, providing healthcare professionals with valuable insights and recommendations. The benefit of AI clinical decision support system in patient monitoring system: early detection of health issues. AI clinical decision support system can continuously monitor patient data, such as vital signs, lab results, medical history, to detect subtle changes or patterns that may indicate potential health issues at an early stage. This early detection can lead to timely intervention and improved patient outcome. Personalized treatment plans. By analyzing individual patient data and considering factors like genetic, lifestyle, and medical history, AI clinical decision support system can help healthcare providers develop personalized treatment plans tailored to each patient's specific needs. This personalized approach can enhance treatment effectiveness and reduce the risk of adverse events. Clinical decision support. AI clinical decision support system can assist healthcare professionals in making informed clinical decisions by providing evidence-based recommendations, treatment guidelines, and alerts for potential risks or contraindications. This support can help reduce medical errors, improve diagnostic accuracy, and enhance the overall quality of care. Efficiency or efficient resource utilization. AI clinical decision support system can optimize resource utilization by streamlining workflow, prioritizing tasks, and identifying areas where interventions are most needed. By automating routine tasks and flagging critical issues, these systems enable healthcare providers to focus their time and expertise where it matters most, اللي هي patient care. Continuous monitoring and feedback. AI clinical decision support system can provide continuous monitoring of patients both within healthcare facilities and remotely, allowing for proactive intervention and ongoing feedback loops between patients and providers. This real-time monitoring can improve care coordination, patient engagement, and treatment adherence. Predictive analytics. AI clinical decision support system can leverage predictive analytics to forecast the potential health outcomes, identify health risk patients, and recommend preventive measures to mitigate risks. By analyzing historical data and trends, these systems can help predict complications or deteriorations before they occur, enabling proactive intervention. يبقى ال AI-driven clinical decision support system, alerting system, order entry systems, diagnostic systems, treatment planning systems, patient monitoring system. Leveraging AI for clinical decision support can significantly reduce burnout among healthcare professionals by providing timely, accurate, and evidence-based guidance that support clinical decision-making. Leveraging AI for clinical decision support to reduce burnout. How leveraging AI for clinical decision support will reduce burnout for healthcare providers? Real-time insights. AI algorithm can analyze patient data in real time, including electronic health records, imaging studies, and laboratory results to provide the clinicians with actionable insights at the point of care. By offering timely guidance and alerts regarding potential risks, treatment options, and care protocols, AI-driven clinical decision support systems empower healthcare professionals to make informed decisions efficiently, reducing the cognitive burden associated with complex clinical scenarios. Evidence-based recommendations. AI can sift through vast amounts of medical literatures, clinical guidelines, and research findings to generate evidence-based recommendations tailored to individual patient characteristics and preferences. By synthesizing relevant evidence and presenting it in a digestible format, AI-powered clinical decision support systems assist the clinicians in staying up to date with the latest medical knowledge and best practices, reducing the uncertainty and decision-making fatigue. Risk prediction and stratification. AI algorithm can analyze patient data to predict the likelihood of adverse events, such as hospital readmissions, medication errors, or complications. By identifying patients at high risk, AI-powered clinical decision support system enable proactive interventions and targeted care management strategies, potentially reducing the incidence of preventable adverse outcome and alleviating the stress associated with managing complex cases. Personalized treatment plans. AI-driven clinical decision support systems can analyze patient data, including genetic information, medical history, and treatment responses to generate personalized treatment plans tailored to each individual's unique characteristics and preferences. By considering factors such as comorbidities, drug interactions, and patient preferences, AI-powered clinical decision support system help clinicians optimize the treatment decisions, reduce trial and error approaches, and improve patient outcomes, thereby reducing burnout associated with ineffective and suboptimal treatment strategies. Clinical workflow integration. AI-powered clinical decision support systems can be seamlessly integrated into existing clinical workflows, such as electronic health records or clinical decision support system to provide contextualized guidance and recommendation within the clinician's workflow. By presenting relevant information at the point of care and minimizing disruptions, AI-driven clinical decision support system enhance workflow efficiency and facilitate informed decision-making, reducing the time and cognitive effort required to assess relevant clinical information. Automated documentation and reporting. AI assists with automated documentation of clinical encounters by analyzing natural language inputs or voice dictating and generating structured notes or reports. By automating documentation tasks, AI-powered clinical decision support system reduce the administrative burden on clinicians, allowing them to focus more on patient care activities and reducing burnout associated with excessive paperwork and documentation requirements. Continuous learning and improvement. AI algorithm can continuously learn from real-world clinical data and user feedback to improve the accuracy and relevance of decision support recommendation over time. By adapting to evolving clinical practices, patient populations, and healthcare settings, AI-powered clinical decision support systems ensures that clinician receives the most relevant and up-to-date guidance, reducing the likelihood of errors and enhancing confidence in decision-making, thereby mitigating burnout. Overall, leveraging AI for clinical decision support holds great promise for reducing burnout among healthcare professionals by providing timely, evidence-based guidance that enhances efficiency, improves outcomes, and reduces the cognitive burden associated with complex clinical decision making. Thank you. أشكر حضراتكم، ولو في أي حاجة مش واضحة أستأذن حضراتكم ابعتولي على الشات. ناخد بريك 10 دقايق ونرجع تاني مع بعض. شكرا لحضراتكم. مساء الخير. مع حضراتكم دكتورة ماري حبيب، ماجستير إدارة جودة الرعاية الصحية من المعهد العالي للصحة العامة جامعة اسكندرية. اتكلمنا من بداية اليوم النهاردة عن the role of AI in combating burnout in healthcare، واتكلمنا عن leveraging AI to minimize administrative burden and for clinical decision support. هنتكلم دلوقتي عن enhancing telehealth and remote monitoring with AI، وإيه الإفكت بتاعه على ال healthcare provider burnout. The significance of remote monitoring and telehealth in modern health. Remote monitoring and telehealth play an important role in modern healthcare, offering numerous benefits and addressing various challenges in the healthcare system. What is the difference between telehealth and remote patient monitoring? In simple terms, the biggest difference between remote patient monitoring and telehealth is that remote patient monitoring uses technologies to interact with patients, to interact with them from a distance, while telehealth encompasses the industry as a whole and the technologies used to provide this type of health care. ايه هي الكي aspects of remote monitoring and telehealth? Increased access to healthcare. Remote monitoring and telehealth technologies enable patients to access healthcare services without geographical constraints. This is especially valuable for individuals in rural or underserved areas who may have limited access to healthcare facilities. Continuity of care. Patients with chronic conditions or those in need of regular checkup can receive continuous care through remote monitoring. This helps maintain consistent communication between healthcare providers and patients, leading to better management of chronic diseases. Early detection and prevention. Remote monitoring allows healthcare providers to collect real-time data on patient health, facilitating early detection of potential issues. This proactive approach enables timely intervention and preventive measures, reducing the risk of complications and hospitalizations. Improved patient engagement. Telehealth platform encourage active patient participation in their healthcare. Patients can access their health information, monitor vital signs, and communicate with healthcare professionals, leading to increased engagement and a sense of empowerment. Reduction of healthcare costs. Telehealth services can result in cost saving for both patient and healthcare providers by avoiding unnecessary hospital visits, reducing travel expenses, preventing hospital readmission through continuous monitoring. Overall, healthcare costs can be reduced. Enhanced access to specialist consultation. Telehealth facilitate virtual consultations with specialists regardless of geographical distance. This is particularly beneficial for patients who may have limited access to certain medical specialties in their local area. Quicker response to emergencies. Remote monitoring allows healthcare providers to respond quickly to emergencies or changes in a patient's condition. Early detection of critical issues can lead to prompt intervention, potentially saving lives and reducing the severity of health crisis. Flexibility and convenience. Telehealth services offer flexibility in scheduling appointments and provides the convenience of accessing healthcare from the comforts of one's home. This is especially beneficial for patients with mobility issues, busy schedules, or those who live in remote areas. Pandemic preparedness. The COVID-19 pandemic highlighted the importance of telehealth in maintaining healthcare services while minimizing the risk of virus transmission. Telehealth is a critical tool for delivering care and managing non-emergency health needs during times of crisis. Improved monitoring of medication adherence. Remote monitoring technologies can be employed to track and improve medication adherence. This is particularly important for patients with chronic conditions who require consistent medication management for optimal health outcomes. Data-driven healthcare. Remote monitoring generate valuable health data that can be analyzed for trends and patterns. This data-driven approach enables personalized and targeted healthcare interventions, contributing to more effective and efficient patient care. يبقى إيه هما ال key aspects of remote monitoring and telehealth? Increased access to healthcare, continuity of care, early detection and prevention, improved patient engagement, reduction in healthcare costs, enhanced access to specialists' consultations, quicker response to emergency, flexibility and convenience, pandemic preparedness, improved monitoring of medication adherence with data-driven healthcare. In summary, remote monitoring and telehealth contribute to a patient-centered, accessible, and cost-effective healthcare system. Importance of leveraging AI for enhancing remote monitoring and telehealth. The importance of leveraging AI for enhancing remote monitoring and telehealth in healthcare encompasses various benefits that contribute to improved patient care, efficiency, and overall healthcare system effectiveness. The key reasons why incorporating AI in remote monitoring and telehealth: real-time data analysis, AI algorithms. AI can analyze vast amounts of real-time health data generated by remote monitoring devices, wearables, and other sources. This enables continuous monitoring and early detection of abnormalities or changes in a patient's condition. Predictive analytics. AI can identify patterns and trends in health data, allowing for prediction of potential health issues. This is particularly valuable in chronic disease management, where early intervention can prevent complications. Personalized treatment plan. Tailored intervention. AI can analyze individual patient data to create personalized treatment plans. This ensures that interventions are tailored to the specific needs, conditions, and preferences of each patient. Remote diagnostics. AI-powered diagnostics tools can analyze medical images and signals remotely. This is especially beneficial for specialties like radiology, where AI algorithm can assist in the interpretation of medical imaging, enhancing diagnostic accuracy. Efficient triage and resource allocation. AI algorithm can assist in remote triage, helping healthcare providers prioritize the patient cases based on the severity of symptoms. This ensures that resources are allocated efficiently, especially in emergency situations. Continuous monitoring of vital signs. AI facilitates the integration of wearable devices that continuously monitor vital signs. These devices can detect deviations from normal ranges and alert healthcare providers in real time. Automation of routine tasks. AI automate routine administrative tasks such as appointments, scheduling, and data entry, allowing healthcare professionals to focus more on patient care. Enhanced teleconsultations. Natural language processing capabilities in AI enable more natural and interactive teleconsultation. AI-powered chatbot or virtual assistants can help gather patient information and provide initial guidance. Remote medication management. Adherence monitoring. AI can assist in monitoring medication adherence through smart pill dispensers and reminders. This improves medication management, especially for patients with chronic conditions. يبقى ايه هما الكي reasons why incorporating AI in remote monitoring and telehealth? Real-time data analysis, predictive analytics, personalized treatment plans, remote diagnostics, efficient triage and resource allocation, continuous monitoring of vital signs, automation of routine tasks, enhanced teleconsultation, remote medication management. In summary, leveraging AI in remote monitoring and telehealth enhances the quality and efficiency of healthcare delivery. By providing actionable insights, personalizing care, and automating routine tasks, AI contributes to a more patient-centric, accessible, and effective healthcare system. As technologies continues to advance, the role of AI in remote healthcare is expected to grow, offering new possibilities for improving patient outcomes and overall health system performance. إيه هو الرول of AI in remote monitoring؟ هنتكلم عن 3 حاجات. The first one is continuous monitoring through wearable devices. AI integrated into wearable devices such as smartwatches and fitness trackers to continuously monitor vital signs and health metrics. These devices provide real-time data on health, on heart rate, blood pressure, activity levels, and more. Enhanced data collection and analysis. AI algorithm embedded in wearable devices can collect a vast amount of data, including heart rate, blood pressure, oxygen levels, activity levels, and sleep patterns. These data points are continuously analyzed to detect any anomalies or patterns that may indicate potential health problems. By utilizing machine learning and deep learning techniques, AI can process this data efficiently and provide valuable insight to healthcare providers. Real-time health monitoring. One of the key advantages of AI in remote monitoring is its ability to provide real-time health monitoring. Wearable devices equipped with AI algorithms can instantly alert both patients and healthcare professionals about any concerning changes in vital signs or health parameters. This proactive approach enables early intervention and timely medical assistance, ultimately improving patient outcomes. Personalized healthcare. AI-powered remote monitoring allows for personalized healthcare solutions tailored to individual needs. By analyzing the data collected from wearable devices, AI can create personalized health profiles for users, taking into account their unique characteristics and medical history. This personalized approach enables healthcare providers to offer targeted intervention and treatment plans that are specific to each patient. Predictive analytics. By identifying patterns and correlation in the data collected from wearable devices, AI can predict the likelihood of certain health condition or emergency occurring in the future. AI algorithm can also leverage predictive analytics to forecast potential health issue based on historical data trends. This proactive approach enables healthcare providers to take preventive measures and mitigate risk before they escalate. Remote patient monitoring. With the help of AI-powered wearable devices, remote patient monitoring has become more accessible and efficient. Patients can now be monitored remotely in real time without the need for frequent hospital visits. This not only improves patient comfort and convenience, but also reduces healthcare costs by preventing unnecessary hospitalization through early detection and intervention. The integration of AI with wearable devices for continuous monitoring. Continuous vital signs monitoring, wearable devices, AI algorithm integrated into smartwatch, fitness tracker, and other wearable continuously monitor vital signs such as heart rate, blood pressure, respiratory rate, and oxygen saturation. This information provides a comprehensive picture of an individual health status. Early detection of health issues, alerts and notifications. AI algorithms analyzes the continuous data stream from wearable devices. If abnormalities or potential health issues are detected, the system can send alerts to both the individual and healthcare provider for timely intervention. Cardiovascular health monitoring. Wearable devices with ECG capabilities coupled with AI can analyze electrocardiogram data to detect irregularities, arrhythmias, or signs of cardiovascular issues. This enables proactive management of heart health. Respiratory health monitoring. Wearables with SpO2 sensors combined with AI analysis monitor oxygen saturation levels. This is particularly important for individuals with respiratory conditions such as asthma or COPD, chronic obstructive pulmonary diseases. Blood glucose monitoring or continuous glucose monitoring. Wearable equipped with continuous glucose monitoring sensors integrated with AI provide real-time monitoring of blood glucose levels for individuals with diabetes. AI algorithm can predict trends and suggest adjustment to insulin dosage. Sleep tracking and analysis. Wearable with sleep tracking capabilities enhanced by AI analyze sleep patterns and provide insights into sleep quality. This information can help identify potential sleep disorders or disturbances. Fall detection and prevention. AI algorithm process data from motion sensors in wearables to detect falls or changes in gait. This is especially valuable for elderly individuals, contributing to fall prevention and overall safety. Medication adherence. Smart medication dispensers. Medication dispensers supported by AI monitor medication adherence. The system can send reminders, track medication consumption, and alert healthcare providers or caregivers if a dose is missed. Stress and mental health monitoring. Wearables with biometric sensors and AI analyze physiological and behavioral data to assess stress levels. This technology can provide insight into mental health and suggest stress management strategies. Remote rehabilitation. Wearables combined with AI-driven movement analysis assist in remote rehabilitation. This system can guide individuals through exercises, monitor progress, and provide real-time feedback. Chronic disease management. AI contributes to the development of personalized interventions based on continuous monitoring data. This is particularly valuable for managing chronic conditions such as hypertension, diabetes, heart diseases. يبقى the integration of AI with wearable devices for continuous monitoring. اتكلمنا عن continuous vital signs monitoring, early detection of health issues, cardiovascular health monitoring, respiratory health monitoring, blood glucose monitoring, sleep tracking and analysis, fall detection and prevention, medication adherence, stress and mental health monitoring, remote rehabilitation, chronic disease management. احنا اتكلمنا عن ال continuous monitoring of remote patient monitoring. طب عايزين نتكلم عن ال remote diagnostics. Image analysis. AI is employed in remote diagnostics by analyzing medical images such as X-ray and MRI. AI algorithm can assist the healthcare professionals in interpreting these images, providing diagnostic support even in remote locations. Successful application of AI in diagnosing condition remotely. Radiology and imaging. AI in radiological interpretation. AI algorithms have been successful in analyzing medical images such as X-rays, CT scans, MRIs. Remote monitoring using AI contributes to assist radiologists in identifying abnormalities, tumor fractures, and other conditions, leading to quicker and more accurate diagnosis. Dermatology, skin condition analysis. AI-powered tools can analyze images of skin condition uploaded by patients. Remote monitoring using AI and dermatology applications contribute to help in the early diagnosis of skin disorders, providing insight and recommendation for further evaluation. Ophthalmology. AI is used to detect eye diseases by analyzing retinal images. Remote monitoring using AI contributes to aid in early diagnosis of conditions like diabetic retinopathy and age-related macular degeneration, allowing for timely intervention and prevention of vision loss. Pathology. AI in pathological analysis. AI assists pathologists in analyzing pathology slides. Remote monitoring using AI contribute to identify patterns and anomalies in tissue samples, helps in the diagnosis of cancer, infectious diseases, and other pathological conditions. Cardiology. ECG and heart conditions. AI algorithm analyze electrocardiogram to detect irregularities in heart rates and identify signs of cardiac conditions. Remote monitoring using AI contribute to the early diagnosis of heart-related issues. Pulmonology. AI applications analyze pulmonary function tests and respiratory data to detect conditions such as chronic obstructive pulmonary disease and asthma. This aid in remote monitoring and early intervention. Neurology. AI assists in the analysis of brain image such as MRI and CT scans for the detection of neurological conditions. Remote monitoring using AI contributes to identify signs of stroke, tumors, and neurodegenerative diseases. Gastroenterology. AI applications analyze endoscopic images to detect abnormalities in the digestive system. Remote monitoring using AI contributes to aid in the diagnosis of conditions like gastrointestinal cancers and inflammatory bowel diseases. Remote monitoring of chronic diseases. AI plays a role in continuously monitoring data from patients with chronic diseases such as diabetes. It helps in identifying trends, predicting complications, and optimizing treatment plans remotely. Infectious diseases. AI algorithm can analyze patterns in patient data to identify potential signs of infectious diseases. This is particularly relevant in the context of early detection and monitoring during pandemics. Mental health. AI application assess mental health through natural language processing and sentiment analysis. Remote monitoring using AI contributes to help in screening for conditions like depression, anxiety, and other mental health disorders. Remote triage. AI-powered chatbot and triage systems help assess symptoms remotely, guiding individuals to appropriate level of care based on the severity of their symptoms. Remote ECG monitoring. AI algorithm analyze the remote ECG data, identifying irregularities or signs of cardiac issues. This is particularly valuable for patients with cardiovascular condition who need continuous monitoring. Successful application of AI in diagnosing condition remotely: radiology and imaging, dermatology, ophthalmology, pathology, cardiology, pulmonology, neurology, gastroenterology, remote monitoring of chronic diseases, infectious diseases, in mental health, remote triage, and in remote ECG monitoring. احنا بنتكلم عن الرول of remote monitoring, patient monitoring. اتكلمنا عن الكونتينيوس monitoring، اتكلمنا عن الدياجنوستكس، اتكلمنا عن هنتكلم عن التيلي هيلث consultations. Natural language processing enhances the efficiency of telehealth consultation. ازاي؟ ايه الابليكيشن of AI in telehealth؟ عندي ال virtual consultations. Virtual assistants use natural language processing to interact with patients, gather information about symptoms, and provide preliminary guidance. They can schedule appointments and answer basic healthcare queries. Remote rehabilitation and physical therapy. AI-based platform guide patients through virtual exercises and rehabilitation program. These systems use computer vision to assess movement and provide real-time feedback, enhancing remote physical therapy. Telestroke services. In telestroke scenarios, AI assists in assessing stroke symptoms remotely. Algorithms can analyze facial features, speech patterns, and other indicators to help healthcare providers make rapid decisions for stroke patients. Tele-ICU, intensive care unit monitoring. In remote ICU settings, AI surveillance systems continuously monitor patient data, alerting healthcare team to critical changes in condition. This enables timely interventions and reduces the need for constant bedside presence. Telemonitoring for pregnancy. AI applications monitor maternal health during pregnancy, analyzing data from wearable devices to provide insights into fetal health, detect potential complications, and offer guidance to expectant mothers. يبقى الابليكيشن of AI in telehealth: virtual consultation, remote rehabilitation and physical therapy, tele-stroke services, tele-ICU monitoring, telemonitoring for pregnancy. والرول of AI in remote monitoring اتكلمنا عن ال continuous monitoring, الريموت diagnostic والtelehealth consultation. Enhancing telehealth with AI can indeed help reduce burnout among healthcare professionals by improving efficiency, streamlining workflow, and optimizing the delivery of care. How AI can be leveraged to enhance telehealth and mitigate burnout? Through virtual triage and triage routing. AI-powered chatbot and virtual assistants can assist with patient intake and initial triage, gathering relevant medical history, symptoms, and concerns before connecting patient with the appropriate healthcare provider. By automating these initial steps, AI helps reduce the administrative burden on clinicians and ensures that patients are routed efficiently to the most appropriate level of care. Remote monitoring and alerts. AI algorithm can analyze data from remote patient monitoring devices, such as wearable sensors or home health devices, to detect changes in patient health status and flag potential issues requiring interventions. By providing real-time alerts and actionable insights to healthcare providers, AI-powered remote monitoring systems enable proactive care management, reducing the need for frequent in-person visits and preventing burnout associated with managing high-risk patients. Clinical decision support. During telehealth consultation, AI-powered clinical decision support tools can analyze patient data, including medical history, symptoms, and diagnostics, test results to provide evidence-based recommendations and treatment guidance to healthcare providers. By assisting clinicians in making informed decisions, AI helps reduce uncertainty يقلل uncertainty and cognitive load, thereby mitigating burnout associated with diagnostic and treatment complexity. Natural language processing. AI-driven natural language processing technologies can transcribe and analyze telehealth consultations, extracting valuable insights from audio or video recording to assist with documentation, coding, and quality assurance. By automating documentation tasks and streamlining administrative workflow, AI-powered natural language processing tools reduce the time and effort required for paperwork, allowing clinicians to focus more on patient care and reducing burnout associated with documentation burden. Language translation and interpretation. AI-powered language translation and interpretation tools can facilitate telehealth consultation between patient and providers who speak different languages. By breaking down language barriers and enabling effective communication, AI helps improve access to care for diverse patient populations and reduces the stress and frustration associated with language-related challenges during telehealth encounters. Personalized care plans. AI algorithm can analyze patient data and preferences to generate personalized care plans tailored to each individual's unique needs, goals, and preferences. By considering factors such as medical history, comorbidities, lifestyle factors, and treatment preferences, AI-powered care planning tools help optimize treatment decisions and promote patient engagement, reducing burnout associated with one-size-fits-all approaches and improving patient outcomes. Patient education and engagement. AI-driven virtual health assistants can provide patients with educational resources, self-management tools, and reminders to support adherence to treatment plans and promote healthy behaviors. By empowering patients to take an active role in their care, AI-powered patient engagement tools enhance treatment adherence, reduce unnecessary healthcare utilization, and improve outcomes, thereby alleviating the burden on healthcare providers and reducing burnout. How AI can be leveraged to enhance telehealth and mitigating burnout through virtual triage and triage routing, by automating the steps of triage. AI helps reduce the administrative burden on clinicians and ensure that patients are routed efficiently to the most appropriate level of care. Remote monitoring and alerts. By analyzing data from remote patient monitoring devices, AI-powered remote monitoring system enable proactive care management and reduce the need for frequent in-person visits and preventing burnout associated with managing high-risk patients. Clinical decision support. AI help reduce uncertainty and cognitive load, thereby mitigating burnout associated with diagnostic and treatment complexity. Natural language processing. By automating documentation tasks and streamlining administrative workflow, AI-powered natural language processing tool reduce the time and effort required for paperwork, allowing for clinicians to focus more on patient care and reducing burnout associated with documentation burden. Language translation and interpretation. By breaking down language barriers and enabling effective communication between patients and providers, AI helps improve access to care for diverse patient population and reduces the stress and frustration associated with language-related challenges during telehealth encounter. Personalized care plans. By considering factors such as medical history, comorbidities, lifestyle factors, treatment preferences, AI-powered care planning tools help optimize treatment decisions and promote patient engagement, reducing burnout associated with one-size-fits-all approach and improving patient outcome. And finally, patient education and engagement. By empowering patients to take an active role in their care, AI-powered patient engagement tool enhance treatment adherence, reduce unnecessary health utilization, and improve outcome, thereby alleviating the burden on healthcare provider and reducing burnout. Overall, integrating AI into telehealth platforms can enhance the delivery of care, improve efficiency, and reduce burnout among healthcare professionals by automating administrative tasks, providing decision support, optimizing workflows, and promoting patient engagement. Thank you very much. لو في حد عنده أي أسئلة أستأذنكم ابعتولي على الشات. Thank you very much. دقيقة ونرجع السيشن اللي جاية إن شاء الله. شكراً. نكمل مع بعض. مع حضراتكم دكتورة ماري حبيب، Master in Healthcare Quality Management from High Institute of Public Health, Alexandria University. اتكلمنا من بداية السيشنز النهاردة عن الرول of AI in combating burnout in healthcare. اتكلمنا عن leveraging AI to minimize administrative burden and for clinical decision support. اتكلمنا عن enhancing telehealth and remote monitoring with AI وازاي بيقلل البيرن اوت للهيلث كير بروفايدرز. هنتكلم دلوقتي عن reducing provider burnout through predictive modeling. AI-driven predictive analytics in healthcare. AI-driven predictive analytics in healthcare refer to the use of artificial intelligence and machine learning algorithms to analyze large volumes of data from various sources, such as electronic health records, clinical trials, medical devices, to predict patient outcomes and identify patterns that can inform clinical decision-making. Analyze, predict, analyze, predict. Analyze large volume of data from various sources to predict patient outcomes and identify patterns that can inform clinical decision-making. In predictive analysis, data will be analyzed and monitor what is happening now according to why this has happened and predict what is going to happen in future. Areas where AI can improve population healthcare management. Predicting chronic and infectious diseases. Predictive analytics can help healthcare providers predict with high probability illness due to a variety of data points, like the patient's birth location, work location, lifestyle habits, local environmental conditions. With this information in hand, providers can then determine a patient's risk of chronic disease and take preventive action. The sector is already seeing results in this area that the rate of some chronic diseases like diabetes, congestive heart failure, and COPD now are in decline. Streamlining patient throughput and workflows. AI-powered predictive analytics can rationalize resource allocations by forecasting variation in patient flow. These forecasts can ensure suitable bed allocations, reorganize the staff to enhance the patient care, and optimize healthcare facility employment rates by extrapolating needs from patient data. Predicting hospital readmissions. With big data analytics, it's possible to predict extreme epidemic conditions using machine learning and high computational power. Contagious diseases can even be predicted with various data sources, such as weather reports, reported cases, population density, economic profile. Analyzing patient deterioration. Through predictive factors analysis, data scientists can understand and monitor disease progression or predict adverse side effects of medication or treatments to provide patients with the right intervention at the right time. ايه هي الابليكيشن of AI-driven predictive analytics in healthcare؟ Risk prediction. predicting the risk of developing specific diseases or complications based on patient data, including demographic information, medical history, and lifestyle factors. For example, identifying individuals at high risk of diabetes or cardiovascular events, and implementing preventive interventions. Patient outcome. Predicting patient outcomes, including recovery rates, readmission risks, and the likelihood of adverse events following medical interventions. For example, anticipating the probability of complications after surgery to guide post-operative care and monitoring. Disease progression. Predicting the progression of chronic diseases based on patient data and historical trends. For example, forecasting the progression or the trajectory of a patient's rheumatoid arthritis to optimize treatment plans. Medication response. Predicting how individuals will respond to specific medications based on genetic, clinical, and demographic factors. For example, personalizing antidepressant prescriptions by assessing genetic markers associated with drug metabolism. Resource optimization. Predicting patient admissions rate, emergency department utilization, and resource needs to optimize healthcare facility operation. For example, forecasting patient admissions during flu seasons to allocate resources efficiently. Fraud detection. Identifying patterns indicative of fraudulent activities in healthcare claims and billing. For example, detecting anomalous billing practices that may indicate fraudulent insurance claim. Early disease detection. Detecting early signs of diseases or abnormalities by analyzing patient data. For example, early detection of cancers through AI analysis of imaging data, such as mammogram or CT scans. Population health management. Analyzing population-level data to identify trends, risk factors, and opportunities for preventive interventions. For example, developing targeted public health campaigns based on predictive analytics of disease prevalence. Readmission risk. Predicting the likelihood of patient readmission after hospital discharge. Identifying patient at high risk for readmission and implementing care plans to reduce the risk. Treatment personalization. Personalizing treatment plans based on predictive analytics to improve efficacy and minimize adverse effects. For example, tailoring cancer treatments based on predicted responses to specific therapies. Remote patient monitoring. Using predictive analytics to monitor patients remotely and anticipate changes in their health status. For example, predicting exacerbation in patients with chronic conditions and intervening proactively. Mental health prediction. predicting mental health outcomes, relapses, or treatment responses based on patient data. For example, identifying individuals at risk of depression, recurrence, and adjusting treatment plans accordingly. Risk stratification and patient prioritization. Stratifying patients based on their risk of adverse events, allowing healthcare providers to prioritize the care for those at higher risk. For example, prioritizing patients with chronic conditions for preventive interventions based on their predicted risk. Optimizing surgical scheduling, predicting surgical care durations, and optimizing scheduling to improve operating room efficiency. For example, using predictive analytics to estimate the duration of a surgical procedures and allocate appropriate time slots. In antibiotic stewardship, predicting the likelihood of antibiotic resistance and optimizing antibiotic prescribing practices. For example, identifying patients at low risk of bacterial infections to avoid unnecessary antibiotic use. Patient satisfaction predictions, predicting factors affecting patient satisfaction and addressing issues proactively. For example, identifying potential dissatisfaction triggers and implementing improvements in patient care. Medication adherence prediction. Predicting patient adherence to medication regimen and identifying potential non-adherence. For example, alerting healthcare providers to patients at risk of non-compliance with prescribed medication. يبقى ايه هما الابليكيشنز اللي اتكلمنا عنهم of AI driven predictive analytics in healthcare؟ risk prediction, patient outcomes, disease progression, medication response, resource optimization, fraud detection, early disease detection, population health management, readmission risk, treatment personalization, remote patient monitoring, mental health prediction, risk stratification and patient prioritization, optimizing surgical scheduling, antibiotic stewardship, patient satisfaction predictions, and medication adherence prediction. Today, health data comes from multiple sources: medical notes, electronic recording from medical devices, laboratory image, physical examination, and even smart devices that capture and track a variety of health data. Leveraging AI, these data can be continuously assessed and analyzed to provide healthcare practitioners and researchers boundless resources to improve diagnosis and treatments. Predictive analysis, we have to analyze data to monitor what is happening now according to why it has happened and predict what is going to happening in the future. What is the data sources? AI predictive analytics in healthcare relies on diverse data sources to train models, make predictions, and derive valuable insights. These sources contribute to a comprehensive understanding of patient health, treatment outcomes, and healthcare system operations. ايه هي الكي data sources for AI predictive analytics in healthcare؟ أول حاجة وأهم مصدر من مصادر الداتا electronic health records. Patient health records containing demographics information, medical history, diagnosis, medication, lab results, and clinical notes. ممكن أستخدم الإلكترونيك health record في predictive modeling for disease risk, for treatment outcomes, and early detection of health issues. Claims and billing data, information related to healthcare services, procedures, and associated costs submitted for reimbursement. We can use claim and billing data in applications like fraud detection, cost prediction, analysis of healthcare utilization patterns, medical imaging, and diagnostic data. Images from modalities like X-rays, MRIs, CT scans, and pathology slides. We can use medical imaging and diagnostic data in applications like image-based diagnostics, early detection of diseases, and treatment planning. Pharmacy data, information on medications prescribed, dispensed, and patient adherence. We can use pharmacy data in applications like medication adherence, prediction, adverse event detection, and personalized treatment planning. Laboratory results, data from laboratory tests, including blood tests and genetic testing. We can use laboratory results in applications like predictive analytics for disease risk, monitoring treatment response, and identifying potential health issues. Genomic and molecular data, genetic and molecular information influencing individual health and disease susceptibility. Predictive modeling for genetic diseases. We can use genomic and molecular data in applications like predictive modeling for genetic diseases, for personalized treatment plans, identifying genomic markers. Remote patient monitoring devices, data from wearables, smart devices, and sensors tracking patient vitals and activities. We can use remote patient monitoring devices in applications like continuous monitoring, early detection of health issues, and predicting exacerbation of chronic conditions. Patient-reported data, information provided by patients about their symptoms, lifestyle, and well-being. We can use patient-reported data in applications like patient engagement, treatment adherence prediction, understanding the patient perspective. Social determinants of health data, information on socioeconomic factors, living condition, and environmental factors. We can use social determinant of health data in applications like understanding the impact of social determinants on health outcomes and predicting health disparities. Clinical trials data, data from clinical trials, including patient demographics, interventions, and outcomes. We can use clinical trial data in applications like predictive modeling for patient eligibility, trial success, identifying potential participants. Population health data, aggregated data on health trends, demographics, and disease prevalence within specific populations. We can use population health data in application like predictive analytics for public health planning. We can use it in resource allocation and preventive interventions. Health insurance data, information on insurance claims, coverage, and reimbursement. We can use health insurance data in application like predicting healthcare costs, identifying health risk individuals, and identifying individual at high risk, and optimizing insurance plans. Environmental and geographic data on environmental factors, pollution levels, and geographic information. We can use environmental and geographic data in application like understanding the impact of the environment on health outcomes and predicting disease patterns. Mobile health application and patient portal. Data generated by patients through mobile applications, portals, and other digital tools. We can use this in application like patient engagement, monitoring lifestyle factors, integrating user-generated data into predictive models. يبقى ايه هم الكي داتا sources for AI predictive analytic in healthcare? Electronic health record, claims and billing data, medical imaging and diagnostic data, pharmacy data, laboratory results, genomic and molecular data, remote patient monitoring devices, patient-reported data, social determinant of health data, clinical trial data, population health data, health insurance data, environmental and geographic data, and mobile health applications and patient portal. How AI-driven predictive analytics in clinical practices reduce healthcare provider burnout. AI-driven predictive analytics have an important role in reducing healthcare provider burnout by streamlining workflow, providing decision support, and optimizing resource allocation. Workload management. AI algorithms can analyze historical data to predict patient flow patterns, allowing hospital to adjust the staffing levels accordingly by ensuring that healthcare providers are neither overworked nor underutilized. AI helps prevent burnout caused by excessive workload or boredom. يبقى firstly, workload management. Predictive scheduling. AI can forecast patient demands based on various factors, such as time of day, seasonality, and local events. With this information, healthcare organizations can optimize the staff schedules to match anticipated patient volumes, preventing last-minute scheduling changes that can contribute to stress and burnout. Clinical decision support. AI-powered clinical decision support system can assist healthcare providers in diagnosing conditions, selecting treatment plans, and predicting patient outcomes by offering evidence-based recommendations and alerts for potential errors. This system reduces cognitive load on clinicians allowing them to focus more on patient care and less on administrative tasks. Risk stratification. AI algorithms can analyze patient data to identify individuals at high risk of adverse health events, such as hospital readmissions or deteriorating health conditions. By prioritizing intervention for these high-risk patients, healthcare providers can proactively manage their care. Proactively manage the care, potentially preventing complications and reducing workload-related stress. يعني بيعمل priority للintervention for high-risk patients. Healthcare provider can proactively manage the care, potentially preventing complication and reducing the workload-related stress. Workflow optimization. AI-driven workflow optimization tools can identify inefficiencies in clinical processes and suggest improvement to streamline operations. By automating repetitive tasks and eliminating unnecessary steps, these tools free up time for healthcare providers to concentrate on more meaningful aspects of patient care, reducing burnout associated with administrative burden. Continuous monitoring and feedback. AI-powered monitoring systems can track healthcare provider performance metrics, such as patient satisfaction scores and clinical outcomes in real time. By providing timely feedback and recognition for achievements, this system promotes a culture of continuous improvement and reduce burnout by fostering a sense of accomplishment and professional fulfillment. Personalized wellness program. AI can analyze individual healthcare providers' data, such as work hours, stress levels, and job satisfaction, to tailor wellness programs to their specific needs. By offering personalized support and resources, healthcare organizations can help mitigate burnout and improve overall well-being among their staff. Reducing provider burnout through predictive modeling involves leveraging data analytics and machine learning techniques to identify factors associated with burnout risks and proactively intervene to mitigate those risks. Reducing provider burnout through predictive modeling. How to reduce provider burnout using predictive modeling. First, identifying risk factors. Predictive models can analyze various data sources, including electronic health records, clinicians' surveys, work schedules, and patient outcomes to identify factors associated with burnout risk among healthcare providers. These factors also may include workload, work-life balance, job satisfaction, organizational culture, and stressors related to patient care. First, predictive modeling can identify risk factors for providers. Developing burnout risk scores. Predictive models can assign burnout risk scores to individual providers based on their demographic characteristics, job-related factors, and other relevant variables. By quantifying burnout risk levels, these risk scores help healthcare organizations prioritize resources and interventions for providers at higher risk of burnout, thereby optimizing resource allocation and targeting support where it is most needed. Number two, we can quantifying burnout risk level and make priority for resources and for intervention for providers at higher risk of burnout. Early detection of burnout symptoms. Predictive models can analyze patterns in provider behavior, such as documentation practices, communication patterns, and utilization of support services to detect early signs of burnout symptoms. By flagging deviation from baseline behavior or identifying patterns indicative of burnout risk, predictive modeling enables timely intervention and the support for providers experiencing distress or dissatisfaction. And number three, flagging deviation from baseline behavior to identify pattern indicative of burnout risk to make timely intervention. Personal intervention. Predictive models can generate personalized intervention recommendations based on individual providers' characteristics, preferences, and risk profile. This intervention may include targeted coaching, counseling, stress management programs, workload adjustments, or referral to support services. By tailoring intervention to the specific need of each providers, predictive modeling enhances the effectiveness of burnout prevention efforts and promote positive outcome. Personalize the intervention according to the need of each provider. Optimizing workload allocation. Predictive models can analyze workload patterns, patient acuity level, and staffing ratio to optimize workload allocation and scheduling practices. By ensuring that workload is distributed equitably and that providers are not consistently overburdened, predictive modeling helps reduce stress and burnout associated with excessive work demand. Monitoring intervention effectiveness. Predictive models can track the outcome of burnout prevention interventions over time, evaluating their effectiveness in reducing burnout risk and improving provider well-being. By monitoring key performance indicators such as burnout rates, job satisfaction scores, turnover rates. Predictive modeling helps healthcare organizations assess the impact of their interventions and refines their strategies as needed. Promoting organizational culture changes. Finally, predictive modeling can identify systemic factors contributing to burnout within healthcare organization, such as leadership practices, communication norms, and organizational policies. By highlighting areas for improvement and advocating for culture change initiatives, predictive modeling supports efforts to create a more supportive and resilient work environment that prioritize providers' well-being. يبقى how to reduce provider burnout through predictive modeling, through identifying risk factor for each clinician. These factors may include workload, work-life balance, job satisfaction, organizational culture, and stressor related to patient care. Developing burnout risk score. By quantifying burnout risk levels, these risk scores help healthcare organizations prioritize resources and intervention for providers at higher risk of burnout, thereby optimizing resource allocation and targeting support where it's most needed. Early detection of burnout symptoms. By flagging deviation from baseline behavior or identifying patterns indicative of burnout risk, predictive modeling enables timely intervention and support for provider experiencing distress and dissatisfaction. Personalized intervention. By tailoring intervention to the specific needs of each provider, such as coaching, counseling, stress management program, workload adjustment, referral to support services. Predictive modeling enhances the effectiveness of burnout prevention efforts and promote positive outcomes. Optimizing workload allocation. By ensuring that workload is distributed equitably and that providers are not consistently overburdened, predictive modeling helps reduce stress and burnout associated with excessive work demand. Monitoring interventions effectiveness. By monitoring key performance indicators such as burnout rate, job satisfaction scores, and turnover rate, predictive modeling helps healthcare organizations assess the impact of their interventions and refine their strategies as needed. And finally, promoting organizational culture change by highlighting areas for improvement and advocating for culture change initiative. Predictive modeling support efforts to create a more supportive and resilient work environment that prioritize provider well-being. Overall, predictive modeling offers a data-driven approach to reducing provider burnout by identifying risk factors, detecting early warning signs, guiding personalized interventions, optimizing workload allocation, monitoring intervention effectiveness, and promoting organizational culture change. By proactively addressing burnout risk factors and supporting provider well-being, predictive modeling helps healthcare organizations foster a healthier and more sustainable workforce, ultimately enhancing patient care quality and outcome. Thank you very much. لو في حد عنده أي أسئلة تحت أمر حضراتكم أستأذنكم ابعتولي في الشات. شكرا جدا. أشكركم. تمام، مفيش أي أسئلة. أشكر حضراتكم، كل سنة وأنتم طيبين. نشوفكم بكرة إن شاء الله. شكرا. السلام عليكم.